How I do this robotics? What implant to be done? What is gap check? Hi, I am Dr. Shivakumar, robotic knee replacement surgeon in Hospital, Namakkal, Tamil Nadu. How I do this robotics? In my hospital, we use MISO robotic system. MISO robotic system is an image-based robotic system where we take a CT scan of the whole limb from head of the femur to the ankle joint. After taking the CT, I put the CT pictures in the MISO robotic software. When the MISO robotic software analyzes the CT picture and it gives me first the 3D picture of the knee joint. In this 3D picture, I can see all the deformity and the growth of the bone osteophytes in the angle of the knee joint, both in the anterior, front of the knee joint and back of the knee joint, and it makes me easy for my patient to explain what is going on, and it's also easy for me to know what is going inside so that I can plan my surgery. After taking this 3D picture, the software gives the axis alignment of the bone from the hip joint to the ankle joint. And I can get the deformity, how much of the knee joint has been bent and how much of correction should I do. And it gives the registration of the whole joint, both in the femur. I can get the registration of the femur. Okay. And after doing this registration, the software gives a suggestion what implant to be done, how much bone should be cut, and what all type of deformity correction can be made. So in this software, this is the way I get how much bone should I cut, what implant should I put, how much degrees of implant rotation I have done, and after I am satisfied with the software, if I am not satisfied, I do this correction immediately and give it to this. Once after all this planning work is done, we get a final plan. The final plan is so that before surgery, this angle was 169, after surgery is 180 degrees. This is the plan. Then with this plan, I take the patient to the theatre, and what I do is open the knee joint and mark all the points of the bones around the knee joint which has been registered in the software before the surgery. After marking, and I do the gap check. What is gap check? It is the soft tissue balance of the knee joint, the medial collateral ligament, the lateral collateral ligament. So in a bend knee, the ligaments will be tight. So without touching the ligament, I rotate the implant, I flex the implant and make sure the gap check both in extension and flexion, the soft tissue balance is so equal. After I am satisfied with the gap check and doing all type of corrections in the theatre with the software and the robotics, and fix that robotics to my table and ask my robotics to do the cut which I have been measured and planned previously before surgery. And the robotics will come and will cut the bone so that the bone is so accurate, the cutting is so accurate. You can just see the cutting of the bone is so accurate and precise, and I can place the implant without any difficulty and reduce the joint. So I am getting a mechanically aligned, corrected bone cut with implant placement, and the gap balance is so perfect both in mechanical and functional. And the knee will be from 0 to full range of motion, it will be equal, so that when we get this equal range of motion, balanced knee, the patient can do all their work like standing, walking, climbing stairs, sitting in the floor, kneeling down, praying, namaz praying, or in a temple praying. They can lift heavy weight, even they can play, they can climb stairs, they can drive all type of vehicles. So it's like having their knee joint which has been functioning in the age of 25 years of age. So in conventional, we use lot of jigs, so that in this there is no jigs. All it has, software has been developed and the cutting is so perfect, and I can surely say that the outcome of the surgical results and the mobility range of motion of the patient doing in robotic replacement surgery is really accurate and successful compared to the normal replacement surgery.